With me now is CTV's infectious disease specialist, Dr. Abdu Sharkawy. Dr. Sharkawy, glad you could be with us this morning. So before we drill down on the numbers of young people getting this, put these cases overall into perspective for us.
Well, this is a growing concern. Certainly, what we were seeing early on in the course of this pandemic, when the lockdown measures and restrictive measures were actually very strict, is that for every one of these young cases identified, the number of potential contacts for each case was in the single digits. That has now changed, and we're seeing that in the double digits. So for every one of these younger people who are testing positive, there are 10 or 15 potential secondary contacts. And that's a big concern here. The sense of lockdown fatigue and the sense of invincibility is probably driving the increased amount of socializing and interactions, probably in indoor spaces more than anything else. And we need to do something to ensure that this trend doesn't continue.
Yeah, there's lots of factors here at play. Partying, going back to work, the reopening of restaurants and retail. I want to play for you and everyone at home what Ontario Premier Doug Ford had to say to young people yesterday. Let's listen.
And I just have a message for the young people. Don't go to a party, simple. Because it might not be you, but it's going to be your parents or your grandparents, as I always say, or your neighbors or your friends or relatives. You're hurting people by doing this.
Dr. Sharkawy, does there need to be a targeted message from public health to this demographic to follow the guidance?
Oh, there's no question about it. And I think it's really important not to succumb to the tendency to just blame and shame. I don't think younger Canadians are inherently bad people. And let's not forget that in many ways they have been disproportionately affected by this pandemic, whether it's in terms of job losses or other forms of social isolation that have led to significant mental health issues. We can't really overestimate the amount of harm that this has done to younger people. They work in the entertainment industry, they work in the service industry, and a disproportionate number of jobs in particular have been lost in those areas. So I think we need to be sensitive to that and to recognize that if we are going to get a message across, it does need to be targeted. We need to use all kinds of social media platforms that younger people are engaged with. And we probably need very targeted campaigns from public health to try and engage younger people and maybe get creative about it. Maybe we have to use food trucks and areas in malls or other places where young people might be hanging out, and providing them with masks and providing them with opportunities to ask questions and to share their concerns, because certainly the messaging that is being delivered right now is not getting through.
Every expert that I've spoken with in the last couple of weeks, many of them your colleagues, have said we should expect to see numbers go up a bit because we are reopening things again. At what point does it become problematic, Dr. Sharkawy?
Well, this is when we have to get into a little bit of math and epidemiology. And there's a number known as the reproductive number, which is an indication of how many people one person who's infected with the virus could potentially infect thereafter. And early on in the course of this pandemic, that number ranged up to 3, in some instances even up to 5. And ideally what you want to see is that number below 1, meaning that there's not a very good likelihood that anyone who's infected will infect another person and allow for potentially exponential spread thereafter. We're seeing that number, that R number, around 1 or a little bit greater in a number of provinces in Canada, especially in Alberta, which is a big concern because they had really controlled the pandemic fairly well until about a month ago. And this is a concern. When that reproductive number is hovering around 1 or greater, that's an indication that we really need to clamp down and make sure that things don't get out of hand.
Okay, Dr. Sharkawy, thank you so much.